Let's look into the autoimmune disorder called as Sjogren syndrome. Sjogren syndrome, otherwise called as keratoconjunctivitis sicca, and this condition is an autoimmune chronic inflammatory disease. As I said, it is more common in the case of females, and the age group involved more commonly seen is the 40 to 60 years of age. And Sjogren syndrome can be of two types, that is primary Sjogren syndrome and secondary Sjogren syndrome. And primary Sjogren syndrome is not associated with any other connective tissue disorders, whereas secondary Sjogren syndrome is associated with other connective tissue disorders like rheumatoid arthritis or SLE. More common is the rheumatoid arthritis than that of SLE. And Sjogren syndrome is otherwise called as keratoconjunctivitis sicca because it is an autoimmune lymphocytic exocrineopathy which involves the glands with ducts. Clinical features seen in case of Sjogren syndrome are dry eye, dry mouth, dry throat, dry skin and dry vagina in case of females. And the antibodies, autoantibodies which are implicated are the anti-M3 antibodies and anti-alpha taurin antibodies. And the dry eye is the presence of dry eye is a non-specific symptom, but the screening test we use is the Schimmer's test. In this test, defective tear production will be checked. Presence of less than 5 mm is often diagnostic of dry eye. And on slit lamp examination, we do with lissamine green and fluorescent dye are used for diagnosis. Presence of dry mouth. The more specific symptom in case of keratoconjunctivitis sicca is the presence of dry mouth. Recurrent episodes of dental caries occurs because of dry mouth. Oral thrush can be seen, and also patient presents with difficulty in chewing and deep red tongue can be found. Extraglandular manifestations in case of Sjogren syndrome. Extraglandular manifestations in case of Sjogren syndrome occurs in 50% of the patients and usually associated with hepatitis C infection. And the autoantibodies which are implicated are the anti-Rho and or anti-La antibodies in case of extraglandular Sjogren syndrome. Sjogren syndrome is of two types, that is primary Sjogren syndrome and secondary Sjogren syndrome. Primary Sjogren syndrome is not associated with any connective tissue disorders, whereas secondary Sjogren syndrome is associated with the connective tissue disorders. Let's see into the treatment plan available for the treatment of Sjogren syndrome. As this condition is associated with all sort of dry mouth and like dry vagina and other conditions, we offer a symptomatic treatment like for dry eye we use tear supplementation, and for dry mouth we give cholinergic agonist, and for in case of extraglandular Sjogren syndrome where the anti-Rho anti-La antibodies are seen. In this condition we offer a treatment like with low dose steroids, NSAIDs like ibuprofen and all, and also other drugs like mycophenolate mofetil, and these are drugs we use in case of Sjogren syndrome, in case of extraglandular Sjogren syndrome. And this is all about Sjogren syndrome, and thank you for watching.